first off, again, thank you all so much for joining us this evening. My name is Virginia. I know most of you, but I'm the owner at Body Mass Gym and Body Mass Composition Testing. So all of you who have some understanding and some relationship with us at Body Mass know that yes, we do DEXA scans, and yes, we do personal training as a component of your fitness, but Chris and I really value the entire holistic approach of health and well-being. So when we got connected with Bionic Health, for us, it was a no-brainer. I will let Dr. Isaac talk in much more detail about Bionic Health's mission, their values, and kind of what they stand for, and you'll really easily see why it is so well integrated with Body Mass. But I know some of you guys know this. I've actually started my Bionic journey about a month and a half ago. And what I've found in the first month and a half is, first of all, the ease of being able to go through the process. I think that's one thing, especially in the medical world, that can become really challenging and inhibiting is if we aren't able to easily get appointments, easily communicate with the doctors, it kind of gets put on the back burner. And then all of a sudden, weeks and months and years pass, and our health problems are not going to go away without getting that help. So the ease of utilizing the Bionic Health app, the ease of scheduling blood work, the ease of meeting with Kelly, who's my Bionic advisor, and meeting with the doctors has made this process for non-tech savvy people like me super seamless. But it's also been insightful and eye-opening. I don't have any current health or medical issues, but there are certain biomarkers that I can look at now at 38 years old and start to take a preventative approach so that this doesn't become problematic later down the line. So I want to introduce you guys to Kirsten's on this call. I'll connect you guys with her afterwards, but I want to introduce you to Dr. Isaac and kind of let her take over.
Great. Thank you so much, Virginia, for that introduction. That was really helpful. So thanks everybody for being here tonight. I'm really glad that there's a good number of people on this call because we're going to be talking about something that I think is really important and I'm super passionate about. And I'm going to be telling you about how the concepts of longevity and prevention relate to what we're doing at Bionic Health. And Bionic Health is the company that I work for. And we are a virtual wellness platform where we provide medical services that are focused on health prevention and, of course, treatment if we identify anything that's abnormal going on. And our mission really is optimal health for all. And so the pertinent word in that is optimal because we take the stance or the philosophy of really wanting to get ahead of problems before they arise and not allowing them to progress rather than finding them and treating them later on when they already become problematic. And so my background is I'm an internal medicine physician and I take care of adults. And I've been working in the field of primary care for quite some time and have always been drawn to medicine because I loved the idea of the simple, basic approach of giving people the education they need to use lifestyle and exercise in order to stay well. And as I was going through my training, it always struck me that we really spent minimal time talking about clinical nutrition, exercise. I have always been very interested in stress management and how stress impacts the body's health. And I mean, we really spent maybe 1% of our training talking about, how to educate and implement strategies to help people stay well. We spent a lot of time learning how to identify disease and to treat disease. And so I want to talk to you about an important public health issue that affects every single one of us, and that's heart disease. So this is the #1 killer in the United States of Americans, and you've probably heard that statistic before and understand that it's important. But when you think of the average person walking around who has evidence of coronary artery atherosclerosis, which is a fancy way of saying plaque in the arteries of your heart, you're probably thinking about somebody who's in the age group of 60s, 70s, 80s, and that it's really not something that someone in an earlier stage of life needs to be thinking about. And that's actually incorrect. So I want to talk to you a bit about that this evening. So we know that heart disease is the number one killer. An interesting statistic that I heard recently is that a woman is 7 or 8 times more likely to die from heart disease than from breast cancer. And I just think that was such an informative statistic, because we do, I think, in a public health setting, focus a lot on breast cancer and wanting to identify and treat it and how it can impact women. And there certainly is a movement to educate people about the importance of heart disease for women, but I really don't think we helped people to understand the impact of how significant this can be on your health status. So, and another interesting statistic I came across is that 50% of heart attacks and heart disease presents before age 65. And in fact, 25% of that is before age 55. So that's actually pretty alarming, because again, we have this concept or idea in our minds that this is something that happens later on in life. We kind of discover it then and we treat it then. And if we think about how plaque builds up in our arteries, it's something that doesn't happen within, a couple of years, period. This is something that takes years and years to develop. So our current medical model is not doing a great job of helping to identify folks who are at risk and educate people so that they know how to prevent themselves from developing heart disease and it progressing, because this is a preventable disease. So that's kind of our philosophy at Bionic, is saying we want to optimize everybody's health now so that they can have a nice long life where they live well. They're feeling healthy and they're feeling strong. So again, just thinking about how atherosclerosis or plaque buildup develops in the body, what happens is you have cholesterol that's circulating in your blood, and inevitably some of it starts to injure the wall as it's traveling through. Over time, that can then embed in the wall of your artery, and you start to develop plaque buildup and inflammation, because your body recognizes there has been an injury to the wall of my artery, and it starts to kind of enclose or encase it with calcification to prevent it from expanding. Now, they have done studies looking at when there is evidence of atherosclerosis. And the crazy thing is that you can see evidence of fatty streaks in teenagers. You can see evidence of plaque formation in people who are in their 20s. And so what we understand is, if this is a process that is taking time to develop, and we're even able to see evidence of this as early as teenage years, we have that long of a runway to do something about it. But yet, again, in our current system, we're really not thinking about this for folks until later on. Maybe you're getting into your 40s or 50s, and then your doctor starts thinking about it. Or if you have a family history, it might be something that they talk about with you. But we're really not being very proactive in helping people to understand that this is a problem that we can identify earlier on, and that we can kind of slow progression or even completely prevent any additional progression. So unfortunately, what I'm going to tell you is that most of us, probably, I'm going to say all of us, not even most, all of us have evidence of plaque in our arteries at this time. So that can be kind of sobering, because you might think, well, if you're involved with body mass, you're probably someone who's health conscious, and you're probably someone who's already thinking about, okay, well, how does my body composition affect, my health, and I want to stay strong. So you might hear that and say, wow, that doesn't fit with the picture of who I am, and how I think of myself. I think of myself as quite healthy. So yeah, that's kind of surprising to think that we all here on this event tonight have atherosclerosis. So in the traditional medical model, which we can call medicine 2.0, again, we're identifying things later on, and we're trying to prolong life later on after disease has already presented itself. What we're trying to do at Bionic Health is practice medicine 3.0, which is being proactive and preventative. So trying to find and identify people who are at risk, and then another difference being treat and reduce that risk as much as we possibly can. Because again, in the traditional model of medicine, we're thinking about risk and calculating that risk. So even if we know that somebody has a high, not a high likelihood, but has a potential for having plaque formation, unless their risk score, we calculate a cardiac risk score to determine, how likely it is to have a heart attack. Unless you meet a certain threshold of risk for heart attack, we don't actually do anything. We say, okay, you're even if your LDL cholesterol, which I can talk more about, is in the 130s, we'll say, well, your risk is low. Don't think you need to take any medication, and maybe start working on the diet a bit. And usually that is the end of the conversation there on how to prevent progression of heart disease. So that's a huge missed opportunity. And again, at Bionic Health, our vision and our goal is to optimize health. So those people who are all falling through the cracks, those are the ones that we're trying to catch and say, hey, hold up, hold on. Actually, you might be in the normal range, but we really want you to be optimal, because when you're in your later decades, we want you to still be functional. We want you to be working out. We want you to be strong. We want you to be picking up the grandkids and climbing around without any functional limitations. And so I can certainly talk more about our strategies at Bionic Health and how to approach those things. So I'll just give you a little bit of a framework, and that might spark some more conversation. So at Bionic Health, when you're a member that signs up, you're going to complete our Bionic baseline. And with our Bionic baseline, you're going to meet your Bionic advisor, who's a health coach and nutritionist, who's going to talk to you about your health habits and your lifestyle. And then you'll have your first initial set of biomarkers checked. Now, in traditional medicine, when you go in for your annual physical, you will have a complete blood count. They'll check a chemistry panel. They'll check your lipid panel. They may or may not check a hemoglobin A1C, which is a test that looks for diabetes. And they may or may not check your urine and a couple of other tests. And depending on where you go, there's a lot of variability in what people are looking for. When you come to Bionic, we have a more expanded baseline of labs that we want to evaluate for folks. So not only are we looking at your, basic complete blood count and your metabolic panel and your lipid panel, we're also checking something called an ApoB, which I can talk more about. We're checking your status for lipoprotein little a, which is a genetically predisposing condition that puts you at higher risk for stroke and heart attack. Again, probably something that is not necessarily checked at your annual physical at this time. We're definitely checking a hemoglobin A1C to see what your metabolic risk is. And we also evaluate some inflammatory markers, and we'll do some baseline testosterone and estradiol testing. So that kind of gives us a nice sort of basic or baseline picture of your health. And then I or one of the other physicians I work with will meet with you and they'll review your health history. They'll review the health habits that you talked about with your bionic advisor, and they're going to review the lab work. And at this point, I then am able to say to you, hey, it looks like from what I'm hearing from you and how you've been feeling and your lab results, we need to focus on your metabolic health. And so we have a nutrition and continuous glucose monitoring module. Or, hey, you have this family history of early onset heart disease, and your LDL and your ApoB levels are not optimized. They're above 100. Definitely want to see them looking a lot better than that. I think we should talk more about that, possibly do a coronary artery calcium score, and also complete our vascular module, which is some additional biomarkers that we use to identify cardiac risk. So in that initial baseline, it gives us the ability to take a look at you and kind of tailor our protocol to optimize your health. In addition to that, we also talk about the importance of understanding body composition and also understanding your physical performance and cardiorespiratory fitness with a VO2 max. So coming to Bionic from the world of traditional primary care, I have to say that this piece of our evaluation, I think, is so valuable that I wish that everybody that comes through Bionic elects to have a body composition and elects to do their physical performance testing. Not everybody elects to do that, and that's okay. But I think when a person undergoes a DEXA scan to have their body composition, it just gives them a whole additional layer of information about their health that they are not able to achieve through basic lab work. And there are some other things that you can check for that you can kind of say, well, this is a different way of sort of getting to the same information. You can check waist circumference, and if someone's waist circumference is greater than you would expect, you're going to say, hey, you have a lot of abdominal fat, etc. But I think when our members complete the body composition portion of the test, it can be so eye-opening when I say to them, hey, your LDL cholesterol and your ApoB levels are not optimized. Your A1C was 5.6, so you're not yet in the pre-diabetic range, but you're getting there. Your insulin level was a little elevated as well, and your visceral fat, which is the amount of fat that's sitting in your abdomen, in and around your organs, is much higher than we would expect. Now, this is something that most patients haven't heard before. I have fat sitting in and around my organs. That puts me at risk for diabetes, heart disease, cancer. It raises my risk of death. Whoa, I really don't like the sound of that. So I love giving people the opportunity to understand that aspect of their health, because I think it's so much more motivating. The same for looking at muscle and your appendicular lean mass index and your fat-free mass index, which is looking at the amount of muscle you have in your arms and legs, and then a total muscle including your trunk and your back. And so I'll just give you a little bit of my own story on this. Prior to starting at Bionic, I was working in primary care and seeing, 18 to 20 patients a day, coming home, bringing home a ton of work, just feeling exhausted and still walking. But I could tell just my physical conditioning was just not great because I was spending a lot of time sitting down. That being said, I did not expect it to be where I found out it was when I completed my own body composition testing. So I was below the 10th percentile for muscle mass. That means 90% of people who are my age and gender and ethnicity had more muscle than I do. This was like very alarming. And I thought, I always imagine myself as being quite healthy. And I do exercise. I walk, 2 to 3 times a week. I'm taking care of my heart. but I was not in any way paying attention to my muscle, which is important for my strength, mobility, prevention of injuries. That really lit a fire for me and said, hey, I have to be super active. I have to start doing strength training. I'm entering that middle age phase of life where I'm going into perimenopause, menopausal period where women start to lose bone mass and muscle. I can't let myself be one of those statistics. So, if I had been going through the usual traditional medical model, I would have came through, they would have said, hey, your labs look great. You're doing great. We'll see you later. And this would have been a huge missed opportunity for my personal health, knowing that I am someone who's likely at higher risk for osteoporosis down the road. And again, just debility, meaning weakness, meaning not being able to, do the usual lifting, bending, etc. So that was pretty profound. And that's why I think it's so crucial for people to undergo this more of a comprehensive model, and what I love about the work that I do now. So I think that that's probably a pretty good introduction into the idea of the importance of health prevention and longevity and Bionic as a medical model to assess risk and reduce it.
Awesome. Thank you so much, Dr. Isaac. That was wonderful. I figured on this call, there will be a lot of people with a wide array of questions for Dr. Isaac. So there's one person who wasn't able to be on the call, really wanted to tonight. She has a few questions. So I will kind of kick off the Q&A. If you do have a question, feel free, this is casual, just unmute yourself. You can ask that question at that time, and Dr. Isaac will be able to answer that. So I'll kick it off with, her question is about when you're getting the blood work and as it relates to hormones. Is there a specific time for women in their cycle that they should get tested that certain levels of certain hormones may be kind of falsely elevated or falsely depressed? Is there a specific time that you'd recommend that for women?
Absolutely. So, as a woman is moving through her menstrual cycle, the levels of hormones that orchestrate that whole process fluctuate rhythmically through that. So it's helpful to know where a woman is in terms of the phase of her cycle, because the levels of each of the individual hormones are going to vary depending on which phase she's in. So for our members who are particularly interested in understanding their female hormone health, checking labs on day 5 of your menstrual cycle would be very helpful in understanding exactly what the levels are telling us. For some of our members, they're not able to necessarily know where they are in their cycle because things have been irregular, or sometimes people get them at different times, and it can just be helpful to know, actually, I finished my cycle 10 days ago. Oh, okay, that probably puts you here, and this helps me kind of get a general idea if things are where they're expected to be.
Awesome. That's very helpful. I'm going to do just one more of her questions while you guys kind of ponder some other questions that you have. And she was wondering about thyroid function. So does the Bionic baseline test thyroid function, or is there some component of Bionic Health that does measure thyroid function?
Sure. We don't test thyroid function right off the bat in our baseline, but we do assess for it with female hormone health. And I believe it's also something that we include in our nutrition module. I'd have to double check on that. And it also would certainly be part of our cognitive module, which we're working on.
Awesome. That is great. All right, Rich, go ahead. You can unmute yourself and ask your question.
Awesome. Thanks, Dr. Isaacs. That was really interesting. Thank you for speaking to that. I read Outlive, so
Oh, great.
all of the concepts. are definitely clear there. So aside from testing, which sounds valuable, getting more information, what interventions do you all do as part of your program?
Absolutely. So our interventions are either nutrition, well, not either. They're going to include nutritional guidance. They're going to include tailored guidance for exercise. I'm going to make recommendations regarding like what the lab's results are. So it might involve prescribing medications and discussion of supplements that could be helpful. If additional workup is necessary, we recommend additional workup, like I might order a coronary artery calcium score, or if someone might be at risk for sleep apnea and I'm concerned, I'll order a sleep study. And let's see, if a referral is needed for a specialist, we'll place in and sort of facilitate that referral. So we try to be quite comprehensive. For our folks that actually do participate in our performance module, where we assess your mobility, flexibility, we assess your upper and lower body strength, and we assess your VO2 max, which you probably heard Peter Attia talk about in his book. We're also then able to give a little bit more specific guidance on that as well, because we can say, hey, you know, your 1 rep max strength and your upper body was this, and let's, you know, aim for you moving up to here. And or your VO2 max was, you know, 32. Let's try to get you up to 35, 36 the next time we do an assessment. So we like to provide a whole range of guidance. And in addition to that, when our members sign up for our platform, it also involves using a chat feature on our app. So we have a lot of members who really enjoy engaging with their Bionic advisor or with us, and they might say, you know, I've increased my protein, you know, but I'm having trouble integrating my regular strength training. And, you know, they'll work with their Bionic advisor on that. Or, you know, I started on this medication and this is what I'm noticing. And so we're able to kind of send chat messages back and forth, helping to kind of address those smaller issues along the way.
Awesome. That's great. Does anybody else have any questions right now? Feel free, you can just unmute yourself and ask. If nobody else does right now, I'll ask this question because I think this could be helpful as people are kind of thinking about, you know, what does taking this approach to their health and longevity look like? So could you explain a little bit about, you know, what does the process look like for somebody once they sign up? Who are they meeting with? What information are they getting from the get-go, and kind of what that looks like?
Absolutely. So when you sign up for Bionic, you're going to, you know, set up your Bionic account, and you're going to kind of walk through your Bionic journey. That's what we call it. And so there's step-by-step guidance on what you're going to need to do to get started. In addition to that, we send you a welcome video, and I will walk through it with you just verbally, because we're all different learners, and say, hey, the first thing you're going to want to do is set up an appointment with your Bionic advisor. And you're going to set up an appointment with LabCorp to get your blood work completed. We also have the option of using Get Labs, where they actually come to your location and draw your blood there. So that is an additional fee if you're interested in that service, but it is a possibility for people who would prefer that for any reason. So the app will walk you through setting up the appointment with your advisor and setting up the appointment with LabCorp. You'll complete that. Once I receive your results, I'm going to reach out to you and say, hey, I have all of your information. It's a good time to schedule your appointment with me. And then we meet virtually and we review all of that information together.
Yeah, from my perspective, like I had said, I am not tech savvy at all. The process of using their app is very user-friendly. Like Dr. Isaac said, walks you through step by step. One thing that I found to be super helpful is my day-to-day is very busy. The thought of trying to like schedule or book an appointment really stresses me out. And like I said, I kind of put that on the back burner. I was able to, straight from the Bionic Health app, go right over to LabCorp, schedule. I walked in, got my blood drawn. All the information was directly sent to Bionic Health. I literally didn't have to do anything besides spend 3 minutes on the app to choose what appointment time, which I literally did one afternoon, booked it for 8 a.m. the next day, was able to do so quickly, and Bionic Health was able to get my info and set up the call with the doctor quickly and painlessly. So that was, again, selfishly from my perspective, one component that was very helpful.
Yeah,
Okay.
and with the initial visit, I just wanted to say that's about an hour-long call with me or one of the physicians. So we really do try to get a good understanding of your medical history and your health habits before we make any decisions. We're not doing a 20-minute visit and then making recommendations based on that.
And I will say the thoroughness, I had met with, and I don't want to, it's Dr. Barrett.
Dr. Barrett, yeah.
Yes, I was like, I don't want to say it incorrectly. So I had met with Dr. Barrett, and when we sat down and did our virtual call, she took obviously the information from my blood panel, but all of the detail from my conversation with my bionic advisor, Kelly. So she was telling me things about myself that I didn't even remember telling Kelly, but it becomes so helpful because she takes the practical component, right? The things that I was able to tell Kelly about what I have going on, what my day-to-day looks like, what my history is like, what my family health history is like. And then she was able to look at it from the scientific standpoint of what info is coming up in the blood panels and how to kind of marry that together into an approach that works well for me. So I can't emphasize enough, just again, how user-friendly it is. So
That's
is
great.
great.
Virginia,
Questions.
you bring
Yeah,
up
go
a
ahead.
really great point, and I don't mean to interject, but our objective is to take the friction out of this entire process for people so that they can prioritize their health. And we are located in all the states where you guys have facilities or gyms or body mass locations. And I think probably important for everybody on this call to understand that one of the questions in the chat was, where do we do our VO2 max testing? And we have partners throughout all the states where we can practice through a third party. So based on where you live, we'd find the closest one and get you set up with them, and we make the appointment for you. So you just have to show up. And like Virginia said, with LabCorp, you can make an appointment so that they see you right away, but you can actually just walk in. If you happen to be on your way to the bank and you see a LabCorp location, you can just walk in because your orders are anywhere in the LabCorp system. It doesn't matter which location you go to.
See, I did not know that. That is very helpful. So Dawn asks about the modules. So what are the different modules? Kind of what do those break down to?
Sure. So I'll give you the list of what they are and then talk a little bit about each of them. So we have a body composition module where you have a DEXA scan, and then the information that is provided from your DEXA scan is interpreted by us, and your physician then will walk you through all of the information from the body composition test and make recommendations based on what we're finding. So again, I kind of gave the example earlier. I'm thinking of a particular patient who's in their early 30s, 31, who on lab testing was found to be pre-diabetic with an A1C of 5.7. Cholesterol panel was not optimized, and then underwent a body composition testing and was in the 54th percentile for having visceral adipose tissue or visceral fat. So it all made sense to us that this was the situation for her. But this person was also struggling with some motivation and habit change. So kind of walking through all of that data together was quite helpful. We have our performance module, which I talked a little bit about, and we do VO2 max assessments and strength, mobility. And if you're local to the Triangle area, we can do that actually at our office, and our Bionic advisors will do your strength testing. They'll do your VO2 max on a bicycle. And then for people who are located in other states, we can do a modified version of strength testing that you can actually do for yourself at home or at a gym. And then in addition to that, we have a vascular module where we're going to be doing a more thorough assessment of your cardiovascular health. One of the things that we look at is your cholesterol balance. So we're able to determine if you're someone who produces more cholesterol or if you're someone who actually absorbs more cholesterol from your diet. And in general, actually, most of the cholesterol in your body is made by your body, not necessarily what you're taking up from your diet, but for a certain proportion of people, they're higher absorbers. We also look at inflammatory markers, and we look at your fatty acid balance as well, because that has been shown to be associated with increased risk of cardiometabolic disease. So that's our vascular module, and that's a set of labs that you complete as well. We have a nutrition and continuous glucose monitor module. In that module, you're going to be wearing a continuous glucose monitor for 2 weeks, collecting that data. You'll also have additional set of labs that's looking at more nutritionally focused things. So like your B12, your folate, your iron level, vitamin D level. There may be a couple of other things that we include in that lab panel that I'm blanking on right now. And then we look at, we'll also ask you to do some like food diary during that time, which can be helpful because if you're having spikes in your glucose, and then you can correlate that to actually, I had ice cream that night, makes perfect sense that your sugar shot up. So we'll review that information, and then we provide a detailed report with the findings from your continuous glucose monitor and whether or not you meet the Bionic optimal recommendations, and if not, how to try to work towards optimizing. Let's see, we have both a female and a male hormone module, and when we say module, we just mean like a comprehensive assessment. So it's involving probably labs, except for the first two I was recommending, and it's going to involve getting detailed guidance from your clinician. So female and male hormone module assessment. We do have a number of people coming in to see us who are kind of questioning whether they're perimenopausal or they are menopausal, and they're wanting to talk about that. We have a number of our male patients who are wondering if they're having symptoms of low testosterone. So we can provide guidance on that and treatment if it is indicated. And so one of my members who came through, was seen at a T clinic, as some people refer to them, and, was offered medicine, but he felt he didn't have like the medicine 3.0 workup that he was really hoping for. And so we were able to provide that and reevaluate his hormone levels, and treatment was actually indicated. So he's been started on that. And then we follow up with you. So we make sure that you're doing okay. And let's see, we also have a sleep module where we assess a variety of different things about your sleep, and we use wearable data. So if you have an Oura ring, or if you have, a Whoop or an 8 Sleep mattress or whatever it is, you'll be able to integrate that data with our app, so that we can actually look at, the time that you spent asleep, the different phases of sleep, and, collect sleep diary information, labs, and that wearable data, and then make recommendations for you on how to optimize your health. And certainly doing a sleep apnea assessment if that is recommended, or indicated rather. And we also are going to be offering a cognitive module to assess your risk for dementia, Alzheimer's disease, vascular dementia. And we're also developing a genetic module to look at, what is your hereditary risk and what do you need to be aware of? This way, you can, be proactive in that regard as well.
Awesome. I think that's very helpful of understanding kind of the different directions that people can go in once they get their bionic baseline. And I know the answer to this, but I will ask you and you can kind of explain as well. If somebody does go through their bionic baseline, do they just follow one module? Can they follow multiple modules? Is it based off of what the doctor recommends? What do the modules kind of look like following the bionic baseline?
Yeah, so really the one of the important things that happens during your baseline is with our review of everything, making recommendations on which modules would be best. So some folks on this video tonight might be aware of other platforms where you can get lab testing and such. I think the difference between Bionic and these other platforms is we're kind of walking you through this whole process. So rather than you taking a shot in the dark and, you know, you'll hear these companies advertise, we test 500 biomarkers. Well, that's great. That doesn't mean it's necessarily relevant for you or helpful for you. So we really like to be able to say, we think checking these additional 6 biomarkers might be helpful and better, you know, understanding your vascular risk. Or, hey, we want to look at your female hormone levels and better understand that. So we certainly provide guidance and say, these are the ones that we think would be beneficial for you. Now, if somebody was like, hey, I'm super psyched and I want to do nutrition and continuous glucose, and I didn't think it was necessary, I could say, you know, I don't know that that was going to provide that much benefit for you, but if you wanted to do it, certainly there's no harm. I think with our nutrition and continuous glucose monitoring module, that could actually be quite interesting for people who are athletes who want to understand how their sugar is fluctuating throughout exercise and training, and kind of give them a little bit more detailed guidance on whether they're fueling properly for exercise. So that one is not necessarily for people who are wondering about, you know, whether they're moving into the diabetic range and having problems with that. So that could also be quite useful, even for folks who are fit and active. Did I answer your question completely?
And I think that's kind of the key that I'm hearing with that is it becomes customized based off of what the individual needs and what is going to help maximize their health in the long run, which is neat. Rich has a good question. So does Bionic Health act as the primary care physician, or is it recommended to retain your primary care in addition to Bionic Health?
Right now, Bionic Health is kind of like an overarching platform. So we do, in general, say it's helpful to have your primary care physician who's there to answer, like, I have cough and cold, I'm dizzy. We're not really set up at this time to be able to evaluate someone's dizziness through a virtual platform. But we actually are going to be moving to providing primary care services, particularly in the North Carolina area.
Excellent. And then I did want this question from Ildi was a good one. It says, I'm on the website. After the initial tests, what does the monthly fee provide?
Kirsten, do you want to take that one?
Yeah, that's fine. So after your initial baseline, the reoccurring fee, the membership fee is $89 a month. And that gives you a handful of different things. One, it keeps you connected and quite possibly, in my humble opinion, the most important, it keeps you connected to your health coach and your physician. So you can continue to access your data and message your health coach and physician via the app anytime you want. And our physicians are incredibly responsive. You're often getting answers from them within a couple of hours at the very most. And I don't know the last time any of you went and messaged your primary care physician, but for me, it was like 72 hours before I got a response. So you get those things. And then every 6 months, you get a bespoke blood panel draw for whatever it is that you're working on, what is top of mind for you and your health. So, you know, you asked about thyroid in an earlier question. just because that's not part of our baseline, if that is something that we find out is an issue for you, then we may be checking for that there. Or if you started taking berberine to get your ApoB down, then you might get that checked every single time for the 6-month checks, so that you can see the progression and decide, is a supplement sufficient, or do I need to move on to a prescription medication? So it's really customized for the individual, and we probably rarely have two of the same.
Yeah, I think that's very helpful. And I think exactly to your point of being able to stay connected with your healthcare team is huge. So often, and this is what I love about Bionic Health and why I started in the world of training and going into body composition testing, is so often people aren't necessarily wanting to invest on the front end, right? They want to wait until there's a problem, where then it becomes a greater time commitment, a greater health commitment, a greater financial commitment. It becomes much more problematic at that later point. And so I think sometimes when you think, okay, well, maybe there's not necessarily something that's imminent, I don't necessarily need this at the moment, by taking that preventative approach and having that regular update and seeing what is changing, what is evolving, how do I need to make adjustments, what can stay the same, what needs to be different. It allows you to constantly be on top of it, so that hopefully you're never getting to that place where it's a bunch of red flags thrown in the air. So that was very helpful, Kirsten. Thank you. I think Ildy's other question was, I want to make sure, do you provide neurotransmitter testing?
No, currently we don't offer that.
Awesome. And then I want to just make sure, Beth had asked, where do you do strength and fitness assessments? So I know you had said in the Triangle area. A lot of the people on this call are in the DC, Northern Virginia area. I know you did say, Dr. Isaac, that there is a way in which you can test it at home. Do you have specific locations in the DC or Northern Virginia area for that?
We would love if Body Mass wanted to take care of that for the Northern Virginia region.
Well, since you asked, sure.
So we have a protocol for doing it in the equipment necessary. The VO2 max is something that I understand you don't currently have, right, Virginia? And so we could do the VO2 max testing at a different third party, and then do the strength testing module with Virginia and Chris's team. Yeah.
Yes, I love that. That is great. Okay, I think we're up to date on all of the questions in the chat. Does anybody else have any questions? Feel free again, throw it in the chat. Oh, Lada has a good question.
Great question.
Are your services covered by insurance? Yes, I feel like that's an important question to ask.
That's a great question. We continue to evaluate how our services could be covered by insurance, but as of right now, they are not. With that said, if you have an HSA or an FSA, which it seems like almost everybody does nowadays, the high deductible plan with an HSA attached to it, then those funds can be used to pay for our service. And I'm the one that writes those invoices. So if they give you any pushback or anything like that, I just rewrite the invoice for you, however it needs to be.
Yeah. I like that answer. That's a good one. So Ildy, I think, are you asking about a body mass location? I think is what you're asking. And correct. We only have one in Arlington in the courthouse neighborhood. We do not have one in Alexandria. Great question. One question I do want to ask, because I know there are some people on this call that aren't necessarily just Florida, Northern Virginia, or North Carolina. There are other states, and I'm sure licensure dependent on various states and what medical professionals are able to provide. I'm sure that's a whole different thing. Is that something that Bionic Health is looking to be able to expand into all 50 states and have this be something where if it's a state that's not necessarily able to receive access to Bionic Health, that hopefully it will in the future?
Absolutely. We have been aggressively licensing in at least 23 states in the last 2 months. And so we should be hitting that 23 state mark, which covers about 80 to 85% of the US populace by the end of middle of September, let's say. So we have most of the Eastern Seaboard. So most likely you guys are covered,
Does that include Washington, D.C.? I know D.C. is kind of its own.
So Washington, D.C. should be covered in the next 2 weeks. Yeah.
Great. Wonderful. Awesome. What other questions? Does anybody else have any more? We have time for one more question. If not, I think we might be in a good spot. Excellent. Oh, this is great. Okay, good, Ildi. How much improvement one could expect from a month, 6 months, a year? Kind of what does that timeline of making improvements look like?
Sure. I'll have to say I'm always pleasantly amazed when I'm hearing the improvements that our members are making. So every Friday, actually every Monday, we give clinical updates on how our members are doing. So just recently, we had somebody who lost 14 pounds, went from doing 0 exercise to walking 3 to 4 miles a day, and actually got into a couple of important referrals regarding cancer risk evaluation. So that was great. Other things, seeing people's LDL cholesterol and ApoB drop from the 160s to down into the less than 70 range. So meeting that goal. Seeing people lose like 5 pounds of their visceral adipose tissue, which is like a huge amount of weight. And, seeing how wonderful that is. Certainly people gaining muscle as well. So just changes in their body composition. And we usually recommend follow-up body composition every 6 months. If you've fallen off the wagon and you haven't really been making as consistent changes as you were hoping for, we might say, hey, let's do it at 12 months. But in general, we like to get a 6-month follow-up on that so people can see how they're progressing through their changes that they're making. I had somebody who's A1C, again, pre-diabetic, now completely in the normal range. And simply by just having the meeting with me and recommendations from his advisor, by the time he put his continuous glucose monitor on, his numbers had actually normalized and his sugars were in the normal range. So that was phenomenal. Those are some of the things that we see at Bionic regularly.
So Dr. Isaac started working with us in April. So everything she just listed off to you was in the 6-month range, roughly speaking. Admittedly, it's highly dependent on what the member wants to do. Our focus is on consistent and sustainable change. And if you are, guns blazing coming in, then we're going to help keep up with you. And that's why staying in touch with your physician and your health coach consistently is super duper important if you want to see that change happen. You can be self-motivated, but if you don't know what your next step is to elevate the challenge and to move further along that path, it's harder to navigate. You don't know exactly which way to go. And so we help our members do that. The average age of our clientele, we have someone that is 21 years old and we have a person who is 74. And so, but I would say our average age is that late 30s to early 50s.
Yeah, exactly.
Yeah. And just like one last thing is our members also, we don't make money on our prescriptions. We don't make money on our supplements. We put that back, we give that access directly to you. So we're not like some of our competitors who are out there that white label their supplements and then upcharge them 50%. In fact, we get a 35% discount on certain products like Thorne. We give it all to you. I think we make like 12 cents on, like $10,000 or something like that of Thorne products. So we don't keep any of that. So
Yeah, I just like to piggyback on that because that's something that's important to me as a physician. We all can be sort of subconsciously biased to, making certain recommendations if we get a financial incentive out of it. So that's something that as a physician, you just need to be aware of. And, so we don't make money off our supplements. So if I'm recommending it, it's because I think you need it, not because I think it'll be good for our bottom line.
Which I feel like is important because, as you alluded to, Kirsten, that's not always the case. Okay, I know there are a couple other questions, but I do want to wrap this up, just kind of giving some final information. And so, Ildi, Meredith, those questions you can hold on to, and Kirsten will be able to answer those. Oh, wonderful. She's doing it right now. So following this call, I'll send out this recording to everybody who is registered for tonight. So you'll all receive this recording. In addition, I will include Kirsten's contact information. So if you have any further questions, a lot of this takes some time to absorb, and then those questions will come once we get off this call. You'll have Kirsten's contact info. You'll be able to get in touch with her directly. We do, since we are partnered with Bionic Health through Body Mass, there is a discount for people who are referred by Body Mass for their Bionic baseline. So Kirsten, do you want to kind of give a quick rundown of that? I can put it in the email as well.
Yeah, absolutely. I mean, all you have to do is use a code and you get 10% off of our services. And that code will be specific to Body Mass. So yeah.
Awesome. So 10% off at with Bionic Health. But again, I just, want to continue to reiterate the importance of the preventative side. And everyone on this call is doing this because they care about their health and they value their health. They want to find ways to make these improvements, myself included. My process, a lot of this is, it's stuff, oh, I need to do a little bit more of this, a little less of this. But once you have a support system to surround you, and once you have some science and some data with the numbers, it starts to become very much at the forefront of your mind and what you do. So thank you guys all for being on this, for taking some time to meet with Dr. Isaac and Kirsten. Be on the lookout for that email from me. Again, it'll have Kirsten's info on there so you can ask her any direct questions that you have. All right, thank you all. Have a wonderful rest of your night.